Hello my people, I welcome you to Agbogidi page. Welcome to our class today once more. Okay, today we'll be looking at how a personality disorder can be diagnosed. How can we diagnose a personality disorder? First, it is important to understand the difference between personality styles and personality disorders. A person who is shy or likes to spend time alone does not necessarily have an avoidant or schizoid personality disorder. The difference between personality style and personality disorder often can be determined by assessing the person's personality function in certain areas. So we have a difference between personality style and personality disorder. If we should say that this person is always shy, we have to look at the person's behavior to know if, for instance, it is in a particular function, it is in a particular activity, it is in a particular act of that person that we can discover that this person always shy. Or does it mean that this person is always shy naturally and then in every function, in every activity, in every action? Okay, then if we should discover this, is it because this person spends time alone gives him the chance of suffering from either avoidant personality disorder or schizoid personality disorder? So we have to look at all these things. So there are some things or some areas you have to consider when diagnosing a personality disorder. What are those areas? We have to look at the work, we have to look at the relationships, we have to look at the feelings or emotions of that person, we have to look at the person's identity, we have to look at the awareness of reality of that person, we have to look at the behavior and then impulse control of that person. If we should look at all these things, and then we have to come to the end in diagnosing whether this person is suffering from a personality style or a personality disorder. Okay, if symptoms are present, the doctor will begin an evaluation by doing what? By performing a complete medical history and physical examination. Although there are no laboratory tests to specifically diagnose personality disorder, the doctor might use various diagnostic tests such as X-rays and then the blood tests to rule out physical illness as the cause of the symptoms. If the doctor finds no physical reason for the symptoms, he or she might refer the person to a psychiatrist or a psychologist. Healthcare professionals who are specially trained to diagnose and treat mental illnesses. So, look at all this. If we should see some symptoms in a person which will be giving us a sign that this person is suffering from personality disorder, or maybe this person is suffering from personality style, the next we have to do is to send this person to a doctor. The doctor will diagnose this person based on what he or she is seeing, how this person responds to what he may be asking the person. What is your name? How the person responds. Where are you from? How the person responds. That is the self-identity of this person. The behavior of this person. Work, relationship, identity. All these things are what the doctor has to examine to find out whether it is true that this person is suffering from personality disorder or this person is just suffering from another problem. So if he should diagnose this person and find out finally that this person has a disorder, what the doctor has to do is to send the person to a psychiatrist or to a psychologist. They are people meant to treat a person with personality disorder. Okay, so psychiatrists and psychologists use specially designed interview and assessment tools to evaluate a person for a personality disorder. So when you send the person to a psychiatrist or psychologist, they have an already made designed interview for this person. So they will interview the person. They will now discover whether it is personality disorder or not through the interview, and then the assessment tools they have. So the doctor or the therapist that will be taking care of a person suffering from personality disorder will base his or her diagnosis on the person's description of the symptoms. What are the symptoms you are having on your body? And then this person will open up and say, this is what I have been experiencing. This is what has been going on. Then they'll be writing it down. Then on his or her observation of the person's attitude and then behavior, the result will be out, whether the person is suffering from personality disorder or not. Then the therapist determines if the person's symptoms point to a personality disorder or not. So, if all the symptoms are named or itemized, then it is left for the doctor or the therapist to know what symptoms that are named. If those symptoms that are itemized are symptoms that jar towards personality disorder, then it means this person is suffering from personality disorder. Then a solution will be given to the person. A treatment will be given to the person.